Yeah, sure. Come in. I've been waiting for you. Alright. Well, how are you? Oh, we're really glad to see you here. As far as I remember, you're here for your cranial nerve exam, am I right? Okay, wonderful. Well, you can sit comfortably right in front of me. Yeah. Is that chair comfortable enough? Alright. Great. Well, let me confirm your personal data really quickly, okay? So your first name would be... That's right. Basically, I have everything in the system, so I just wanted to verify a few things, okay? Your last name? Right, that's what we've got. Your home address? And your phone number? Right, that's exactly what we've got. And your email address, could you spell it, please? Oh, that's so fast. Okay. Great. Right, okay, everything seems to be just fine. Well, how have you been feeling lately? Would you like to tell me anything? Any issues that would be concerning for you? Okay. Have you had any kind of injuries lately? Been in any kind of accidents or something? Have you had any infections related to your nose, throat, and any ear infections? Okay. Got it. Right. Well, when you wake up in the morning, do you feel any kind of dizziness? Do you ever have any migraines, flashes for your eyes? Any other kinds of headaches? Pain in your neck? Any kind of numbness in your face so that you wouldn't feel some part of your face or something? Okay. See, got it. Right. Okay, a few more questions. How often do you drink, if you drink any kind of alcohol beverages? Let's say how many times a month or a week or a year, so it really depends, like, just approximate frequency. Do you smoke? Yeah, I mean tobacco. Well, then talking about sports and other like physical activities. How often do you exercise? If you exercise at all? Yeah. Of course, it's extremely important for you, but right. How would you actually, let's say, like assess your physical activity from 1 to 5, where 5 is like very often that you exercise or workouts almost every day, and 1 is when your physical activity is quite low, with minimal exercising and stuff. What kind of physical activities do you prefer? Yeah, it's more like off the record question. Just wonder. Right, okay. Got it. Right. What about your diet? Do you think you consume enough carbohydrates, fats, proteins, and all these macronutrients and micronutrients as well? Right. Okay. Yeah. How many times a day do you usually eat? How many meals do you have? Do you belong to those people who usually skip their breakfast? Okay, got it. When it comes to your blood pressure, do you have hypertension, any other kinds of issues? Yeah. So usually is your blood pressure within normal, or would it be too low, too high? Got it. I see. Alright. Well, I might have some more questions in the process, but for now, that will be it. Right? Thank you so much for your honest answers. Yeah, sure. I'm a doctor. I will never judge you, so you can tell me anything. Of course, it's important if that's like you're a bit honest with me, then it will be easier for me to come to some conclusions and just to evaluate your general condition. Sure. Okay. Well, first, since it's your cranial nerve exam, when was your last one, by the way? Well, I just wanted to remind you a little bit that in general we're gonna inspect all 12 cranial nerves today. Yeah, so basically you don't really need all this medical information, all these details, but just in case you were wondering, just in case you're interested, so I can tell you a little bit more in the process, okay? Yeah, so here on this picture you can see how they actually, where they are located, like more or less. Of course, it's very, very like approximate, it's very rough depiction of what is going on in your brain, but still. And here you can see different groups of cranial nerves, and today we're gonna examine all of them. It's actually easier than it sounds. Yeah, it might seem like it will take us like a few hours, but not really. So there are a lot of really simple, really accurate tests that will show us how well all these cranial nerves function. Yeah, of course. So I will tell you a little bit more in the process, right, as we go. Sure. Okay. Just a second. I will just. Okay. Good. Well, so I guess that we will start with your olfactory nerve. And olfactory nerve is basically it's more about your sense of smell. If in other words, right? So it's not something really unusual. So it's what you use every single day. Have you noticed any changes in your sense of smell lately? So do you think that you perceive all the smells as you used to? Has it ever happened that you would feel the smell that nobody else could feel, or vice versa? Okay. Have you noticed maybe some changes in what certain items used to smell like before and what they smell to you right now? Like how they smell to you now? Yeah. Good. Right. Okay. Well, I suggest that we get down to check it. Okay. Get some cotton swabs, right? And I will just let you smell different kinds of testers. So there will be quite a few of them. Yeah. And before we do that, I'll just spray this sanitizer onto my hands. Yeah. So I will also put on my latex gloves a bit later when I have to touch your face, but yeah, for now that will do. Okay, great. So I'll get some stuff and we'll see how well you're able to differentiate between those kinds of smell. Okay, please take a smell. There's no hurry. You can take as much time as you want, as you need. But I suppose that it shouldn't be really that challenging, right? So what did it smell like? Citrus. Absolutely right. Okay, great. Now on to the next one. to you? Right. Are you sure? Peppermint. Exactly. Great. Now another one. Alright. About this one. Chocolate. Amazing. Okay, great. And let's do one more. So far you're doing really, really good. Cinnamon it is. Amazing result. Okay. And right away there's a facial nerve that together with olfactory, it basically is responsible for your sense of smell and for your sense of taste, right? So the same as glossopharyngeal nerve, okay? So let's see how your sense of taste works. I will just ask you to stick out your tongue, and I will drop tiny amount of this syrup onto it. Okay, so would you please stick out your tongue? That will do. Okay, wonderful. Okay, great. So what kind of taste is it? Sweet, right, Sean? Great. And let's get one more. Okay. Right, so what now? Okay. It's bitter, right? Yeah, amazing. Okay, great, thank you. Thanks a lot. Wonderful. Alright, well, now I will test your eyesight. I use the light. It's gonna be a little bit bright, but that's how we're gonna test your pupil reaction, okay? So just relax and let me have a look. Okay. There's the other one. Wonderful. Okay, now put my hand right in the middle between your eyes. Okay, perfect. Okay, that's perfect. Great, thank you. Okay, now I'm gonna test your corneal reflex right away. The blink reflex, in other words. So you can just look at my nose or wherever you want. I'll put this brush a bit close to your eyes, close to your face, but please don't be scared, okay? So I won't put it right in your eyes, so don't worry about that. We'll just see how your blink reflex works, okay? Exactly, great. Okay, wonderful. Now it's fine. Good. Okay, now I will ask you to trace the light with your eyes only, but please don't move your head, okay? Now please concentrate on my nerves. We're gonna test your peripheral vision. I will ask you to tell me when the light appears in your field of view, in your field of vision, okay? Great, but please look at my face. Don't look at the light directly. Thank you. You can simply nod or say yes or whatever. Even raise your hand, doesn't matter. Great. Wonderful. And now let's do the opposite thing. Please just tell me when it disappears from your vision, okay? Thank you. Alright, thank you. Now let's do some last thing with my fingers, okay? So just let me know when they appear in your field of vision. On both sides, please. Okay. Now and then with another one. Wonderful. Thank you. Right. Now just tell me when my fingers wiggle on either side, okay? Alright. Thank you. Alright. You're doing great. Okay, now just follow my fingers once again with your eyes only. Yeah, perfect. Okay, great. Now please look at my nose and tell me how many fingers I'm holding up, okay? Okay. Okay, great. Thank you. Doing really so good. Now let's just quickly test your vision acuity, okay? So I will show you a Snellen chart. It's pretty standard procedure, okay? So I'm sure you have seen it many times. I even have the one behind me, right? So the big one. But today I will show you a smaller one that is will be a bit closer to you. Would you please tell me which is the smallest line that you can still see enter it? Okay, would you please read it for me? Good. Great. Amazing. What about the very lowest, the very smallest one? Can you see it? Let's give it a try. Right. That's alright. That's totally fine. And finally, your color vision. Let's test if you can possibly be colorblind or not. So it's not gonna take too long, I promise. Some Ishihara tests. So, okay, I'll put it this way. It's a pretty challenging one, but still, would you please tell me, can you see anything here? It's not easy. Anything at all. So you can see the square. Can you see anything inside the square? Like I said, it's quite challenging. Okay, great. So there is a circle of some kind. So yeah, like letter O here. Right. Can you see it that way? Okay, wonderful. What about this one? Can you see anything here? Okay. Letter X. Right. Thank you. What about this one? Can you see anything? Any shape, any figure? So there's like a curve similar to letter S. Right, you're like a snake. Okay, great, amazing. Good job. Okay, great. What about now? You see anything in this chart? What is it similar to? Better W. Okay, amazing. And in this one, is there anything? You see any shapes maybe? Figures. Also like a curvy line. Okay, would you please trace it for me? There it is. Okay, amazing. So, I started with really challenging tests, but you nailed them. Okay, I will show you a few more standard ones. Let's see if you can see anything there. So, what about this one? How many circles can you see in the picture? Okay, great. Right, so please tell me, what can you see inside them? Any numbers? Okay, awesome. What numbers can you see? What about this one on top? Okay, great. And this one? Wonderful. And what about this? Okay, this one. Okay, this one. Amazing. And finally this one. Wow, you're doing really good. So your results are quite impressive, especially taking into account that I showed you really difficult ones. Okay, so you're not colorblind. I can guarantee you that. Now, I'll just put on my gloves and have a look at your mouth, throat, and your nose, okay? Great. I will also use the otoscope and the spatula. Okay. Would you please open your mouth? Wonderful. Okay, would you please stick out your tongue just a tiny little bit? Thank you. Just have a look. Right. Okay, great. Now, could you please move your tongue? Let's move it to the side. Yeah. You can move it like that, like against your cheek, like this. Okay. Okay, great. And on the other side? Wonderful. Okay, great. So, your hypoglossal nerve is working just fine. Now, let me have a look at your mouth once again. Now, let's say, okay, great. Now, your nose. Wonderful. Let me do this mirror first. Wonderful. Okay. Great. Now could you please close one of your nostrils? Yeah, with one hand. Exactly. And breathe in. Breathe out. Okay, wonderful. Now the same thing with the other one. Good. So you can breathe with both of your nostrils just fine. Wonderful. Oh. And your hearing, can I look at your ears? What if I press Just like that. Okay, great. Now I will make some noise on one side and I will just tell you some words, okay? So you will just tell me what you heard, okay? Living room. 41. Great, now to the other side. Glasses. 68. Okay, wonderful. Now the other side again. Lipstick. Great. Now the other side. Windsurfing. Snellen chart. T-shirt. Football. 84. 71. Okay, great. Now I will ask you to close your eyes and tell me which side, which ear the sound is on. Okay? Thank you. Are you ready? Amazing. What about now? Are you sure? Let's try again. Let's double check. Okay, what about now? And now? Okay, wonderful. Now, could you please look at me? Okay, I will ask you to give me the widest smile possible. Thank you. Okay, now would you please clench your jaws? Like that. Don't let me roll your chin down. Don't let me open them. Okay, thank you. Great, puff your cheeks up. Okay, exactly. Hold there. Don't let me close them. Okay, thank you. Great. Now could you please swallow for me? Yeah. Okay. Okay, great. Now raise your eyebrows. Good. Would you please frown at me as if you are angry? Thank you. Shrug your shoulders, please. And now could you please raise them and don't let me put them down. Okay, wonderful. Great, thank you. Okay, now I will just have a look at your eyes for another moment. Everything is just fine. Would you please look up once again? Look down. Once again, look up and down. Look to the side. To the other side. Now, would you please close one of your eyes? Do the same thing. Look to the side. Follow the light for a moment. Now, please close another eye. The other one. Once again. Okay, great. Awesome. Right, now let's check your sensation. I will poke you really slightly with this tip of the brush. It's not really sharp or something, so please don't worry. Yeah, it's not gonna hurt. Please close your eyes and tell me when you feel the touch. Great. Wonderful, okay, great. Now, let's reflex. I would ask you to put one leg over the other, bend them the way. And now you know what to do. Wonderful. Now I will just put my fingers under your chin, okay? Don't worry, I will just put it slightly like that, exactly. Okay, great. Right, well, do you have any questions? I will just enter some of your results. Yeah, thanks for your patience. Thanks for your time. Everything works just fine as it's supposed to function. That's alright. Once again, is there anything else you'd like to tell me? Maybe you remembered some other issues you've had lately. Okay. That's great. Perfect. Okay, great. Well, then I have to let you go. Thank you so much. Oh, you're really welcome. Yeah, it's been a pleasure to work with you. Have a good one. Yeah, sure, thank you. Yes, absolutely. I'll see you soon.